Test 1 2 3. Testing 1 2 3. Test, test, 1, 2, 3. Test, test, 2, 3, 4.
But I'll give you a hug, even if you won't accept it. I'm coming.
Okay.
Can everybody hear me okay?
We can hear you, Jeff.
Hey, thank you. So turn it down for one. So just as a note to everybody, we're going to go ahead and start the recording, but we're not going to put it live. So Dr. Weber, whenever you're ready, just tell us, and then as soon as you tell us you're ready, we will switch over to live feed. Dr. Weber, did you get that?
I can hear you, but can you hear me?
I can now, sir, yes.
Ken, Dr. Weber.
Anytime you're ready, I'm ready.
Oh, all right, here we go. We're going to switch to live.
Hey, Jeffrey, before you do that,
We don't have counsel.
Yeah, we don't have legal counsel yet, so I'm still trying to.
Oh, I'm sorry.
Yep. So I'm texting him. I've been texting him. So as soon as we bring it on, then we can go live.
David, do you want to tell all the members that are on the phone that if they're not talking, it may be wise for them to mute their phones so that we don't get feedback?
Absolutely. Thank you for that reminder. And I'm going to mute a couple of people right now that I can remotely. And so that's a great reminder. So please make sure that you are muted at any time during this thing, unless you are going to be recording out. Then you
And the script that I have to read, this meeting of the Board of Managers Board of Tarrant County Hospital District is now called to order. Welcome to all of you who are participating. I am pleased we are now able to meet by means of electronic participation, thanks to the emergency orders of Governor Greg Abbott and Attorney General Ken Paxton, dated the 16th day of March 2020, which have temporarily suspended certain requirements and provisions of the Texas Open Meetings Act. Though we are not able to physically meet at the boardroom, board members are participating today by video conference using the WebEx web conferencing application. This is our first meeting by web conferencing, so I'm begging all of you and the staff and general counsel for Tarrant County Hospital to be patient and to do our best to make this as smooth and effective as we can be. Now I have to physically call the roll and to establish the quorum. So I'm just going to go down my list. Charlie Powell.
Here,
I couldn't hear Charlie.
can you hear me now, Chuck?
Yeah.
Can you hear
Okay.
me? Yeah,
Gotcha.
I'm in, Chuck.
DT.
Yeah.
Amanda.
Here.
Okay. Dorothy DeBoe. Dorothy. Is Dorothy there? Can you hear me, David?
Dorothy, you should be able to speak now.
Dorothy?
Yes, Dorothy is
Okay.
here.
Reverend Ralph Waldo Emerson.
Here.
Roger Fisher. Can't hear him, David.
You all remember to mute, and then you'll be able to be heard.
I am here.
Steve Montgomery.
Present.
Trent Petty.
Here. Where's Dave?
Steve Simmons.
Here.
Zim Zimmerman. Zim, are you there?
Here.
Okay. And here are the procedures for the meeting. Any board member or staff member wishing to speak will need to let me know by use of WebEx or by text to my cell phone. In order that we're not talking over each other, you'll need to wait to speak until I can give you the floor. I'll attempt to call you in the order in which the request was received. On these motions, when a motion is appropriate, a member of the board who wishes to make a motion will need to wait until I recognize you to make it. The same procedure will apply for a second to the motion. And then I have to call on each board member one at a time for each vote, one at a time. Any questions about all that? Anybody?
Chuck, what you may want to do is just kind of look at your phone and take the volume off, because every time it rings, obviously, that we're going to hear that.
Okay. I hate this little bugger.
It's okay. You're doing well.
Ugh. All right. Now we're going to proceed to the order of business that's on the agenda. So is Leanne available for the prayer, Robert?
She is.
Okay.
Leanne, if you could join us.
I am here, but I guess I'm not able to.
Yep, you're good, Leanne. We can hear you now, Leanne. Go
Okay,
ahead.
great. Okay, great. Thanks. Okay. Hi, everybody. Let us pray. As we gather together this afternoon, we're aware that there's never been a time when we've needed divine intervention more than right now. We're aware that there's never been a time when we've been prouder of the heroes with whom we serve. And so we humbly ask, please, be with all those who are on the front lines, risking their health and their lives. Be with all of us in this virtual room, with all who are making crucial and critical decisions. Be with all our leaders who are serving resourcefully, creatively, collectively. Be with all of our patients our families, and our community. Give every single one exactly what each needs. And let us all remember that we're in this together and that we will get through this. In your holy name we pray. Amen.
Amen. Can you folks see this?
We can.
Then we'll pledge allegiance to the flag then. Y'all ready?
Yes, sir.
Go.
Okay, I pledge allegiance to the flag,
flag
of the
The
United States of America,
America.
and to the
and to the
republic
republic
for which it
which
stands,
stands
one
one
nation,
nation
under
under
God,
God,
indivisible, with
With
liberty
liberty
and
and
liberty
justice
and
for all.
justice for all.
All right. Next thing on the agenda is there are no citizens that were signed up, so we're going to approval of minutes, and there's 5 sets. Can we do these one at a time or all 5 at once? I need Neil to tell me that.
Chuck, can you hear me? Chuck, can you hear me?
We can, Neil.
Chuck?
We,
Okay,
we,
good.
we can hear you.
And I'm on the audio. I don't know what's happened technically on this other end. Yeah, you need to vote on each one.
All righty.
Do you need a motion?
I need a motion and then a second.
Chuck, this is Charlie. I'd make a motion we accept the Board of Managers special call board meeting of February the 7th.
Okay. Is there a second to that? I couldn't hear who it was.
Reverend Emerson, second.
Okay, and then if I read this right, I've got to go through the roll call again and get your yay or nay.
Yeah, yeah. In order to understand, Suzanne's got to be able to record who's voted yay and nay.
Okay,
Neil?
Charlie, go ahead.
Yeah.
Chuck, I made the motion, yes.
All right. And who seconded it?
I did, Reverend Emerson.
Okay. Any discussion about
Robert,
it?
do you have a question?
Yeah, Neil, would it be proper? Suzanne knows everybody that's here, and
Right.
we've already had a roll call. Would it be appropriate if anybody had an opposition or did not want to vote for him? Could they then state that instead of going through each individual person 5 times?
That would be, yeah, that's a permissible approach, yes. And then,
Super.
then everybody else would have been a yes vote, yes.
So, Mr. Chair, if you would just ask for any dissenting votes for the February 7th meeting,
You got it.
then I think you're good.
All right. Any dissenting votes from the 7th February 2020 meeting? Not hearing any, we'll go to the Board of Managers February 13th, 2020 meeting.
Move approval.
Second.
Okay. Any discussion? Anybody says negative, please say so. Not hearing any, we go to the Finance Committee February 27th, 2020.
Move approval.
Reverend
This is
Emerson,
Steve.
move approval.
This is Steve seconds.
All right, you got that?
No, I didn't get that. It was too cluttered up. So can someone tell me who was the first to motion?
Reverend Emerson.
And then Steve seconded it, Suzanne.
Got it. Thank you.
Any negative votes? Motion passes. Quality Committee, March 5th, 2020. Entertain a motion to approve.
Zimmerman approves.
Steve Simmons seconds.
Discussion? I don't hear
Yes,
any.
I have a correction.
Okay,
So on those, it should say meeting was March the 3rd instead of September the 5th.
This is Suzanne. I received the correction and it will be edited.
Thank you.
all righty. Human Resources Committee, January 23rd, 2020.
Chuck, it's Charlie. I'll move for approval.
Okay,
Reverend Emerson,
Second.
any discussion? I don't hear any negative votes, so those pass. So we'll now be moving on to part 5 of the agenda, which is Board Chair Report and Action. I could speak for about an hour and a half about all of this, but I would just like to limit it to one thing, and that is to say thank you to all of those that keep working tirelessly during this epidemic, and our hearts go out to those that have lost family members. Now it's yours, Robert.
Thank you, Mr. Chair. I think you all have mentioned this before, but I think in the history of our lives, none of us have witnessed this before. And my 8-year-old nieces, when they are 80 years old, will be reporting about this time in their lives. It's very much like my father when he talks about being 6 years old and living through the Depression and what that was like. This will be a memorial and a memorable event to all of us. Every day I see people who are afraid and fearful. I see people that are creating extreme acts of humanity. It's personal to me in the sense that no family member so far has contracted the coronavirus, but I have a fear, not for myself. I have a fear for my daughter. My daughter has been in the JPS emergency room on numerous occasions, as recently as January, with severe upper respiratory challenges. And the great crew at JPS get her through that. But I don't want her to deal with the coronavirus. So there is a fear that all of us have, and it's a real fear. And then to the juxtaposition of that, we have the incredible caregivers. We have an emergency room doctor who, when we had our first suspected case, literally shaved his beard with a dry razor. There are acts of humanity that are beyond compare. What I try to do as the CEO is address the morale needs of 7,200 employees, and I try to deal with their safety needs. We try to make decisions every day that are going to impact to the benefit of all of our employees, all of our patients. We try to be considerate of our community financially. We do this while making reports to the press. We do this while making reports to other community hospitals. We're talking to people in New York. We're talking to people in Washington State and New Orleans in particular about what they've faced, what their doctors, what their nurses are facing. We're talking to people that are going through challenges greater than ours. To put things in perspective, you all as a board need to understand that there is an incredible team of people, from everybody that walks in the door at JPS to the group of executives that I work for and work with. They are putting in 13-hour days, and they've done that for a good month and a half. It's been amazing. There are discussions that will bring you to tears. There are discussions about the capacity of our morgue. There are discussions about, in an ethics review, if you have 60 ventilators, but you have 72 people that need them, what do you do? And I think that puts a lot in perspective. I will tell you that there is extreme collaboration that I've never seen before between the area hospitals. We talk very candidly every night or every other night about bed capacity. We talk about surge plans. We talk about nursing and doctor capabilities. We talk about morale. We talk about testing. And those open conversations are amazing. I think that JPS has seen numbers that are manageable from the standpoint that we rolled out quickly. We immediately decreased the community level transmissions by working from home. And we had 1,500 employees that could effectively work from home. And to David Mendenhall and his IT team, it was a Herculean task to get laptops and people and still guarantee at this point the safety of our systems so that we can have encrypted messages and dialogues and community outreach like the one we have for this meeting. That takes an incredible amount of work, and David and his entire team have lifted that area of JPS. We've restricted visitation immediately. We eliminated elective surgery. We were one of the first to screen all of our employees and all visitors. We took nurses and employees in areas that had been either redesigned or reduced. We took those employees and we put them on the front line for screening. We gave everybody questions and took their temperature so that we could guarantee the safety of our employees, guarantee the safety of our patients and the community. All of our employees are masked at the present time, and we're moving to masking all visitors and all of our patients. What we now deal with is what happens next. And we're all trying to figure out the surge plan. We are using data that is being generated by the Dallas-Fort Worth Hospital Council. And we're using also data out of Washington State that has been funded by the Gates Foundation that looks at not only trends nationally, and we can look directly at what happened internationally from China and Italy and Spain, but we also look at what's happening in New York, Washington State, Detroit, and New Orleans, some of the unfortunate hotspots. We have set up a daily command center to deal with the surge that's led by Karen and Michael. We talk to everybody on the team about what our capabilities are. Our bed capacity right now could increase by 275. We're also looking at our Arlington facility where we have medical gas available in rooms and trying to figure out what we could do if we had to stand up that. Talking to my colleagues, it appears that on a general number, you're looking at about a 25 to 35% decrease in patient volumes, not only for us, but for our colleagues. That has created its challenges, obviously, to many of our colleagues, but it's also allowed for employees to work in other areas. So we have a great deal of cross-training going on. We are creating negative pressure rooms. We're creating additional isolation rooms. We have increased, as I mentioned, the tough discussion about our morgue. We've increased our morgue capacity from 11 to 38. We've also had a very strong working relationship with UNT Health Science Center, with Leanne and all the work she's doing to use their capabilities at additional morgue space should sadly and unfortunately that be needed. We are expanding our testing capabilities. That has been the biggest difficulty. We hear from those issues quite often, and they are challenging. I will tell you that our expanded testing capabilities happened yesterday with a gift that THR provided us with an ID Now capability for more immediate testing. And also our friends at Cook Children's has allowed us to bring 2 to 3 patients samples a night. They can turn that around between, if we get it to them before 8 o'clock in the morning, they will have results to us by noon that day. The private labs that we've been using were good at the beginning. We were getting response times for our samples in 24 hours. Then that became 48 hours and 72 and so on as each lab throughout the nation got busier and busier. Our PPE levels, we monitor them daily. It is a challenge. If asked the question, which I'm asked every day, do you have enough personal protection equipment? Do you have enough PPEs? The answer to that is today, yes. Become challenges, but we are sourcing. Now, to that point, I will caution you all that we have a lot of people who are all good-intentioned people who will call us and say, I have available masks for you. I have available gowns for you. Some of those are legitimate, and some, unfortunately, are not legitimate. They may not be FDA approved. They may not have the volumes they talk about. So we have been very cautious at trying to deal with the vendors that we have had a working history with. And we continue to do that and continue to work through that. I will tell you that our supply chain team is going through every vendor that we hear about. And many of you all board members have told us about everything from sanitizers to gowns to masks. We have tried to follow up on every one of those. I still have one to follow up with Mr. Powell on some sanitizer that we just couldn't get to yesterday. But we're working with state, local, and federal leaders, and they are cooperative and they're helping us. So we are doing everything we can from a surge plan standpoint. We're trying to do everything we can from expanding testing, and I sincerely thank THR and Cook Children's for their help. And we are getting word that we are getting more reagents sent to us, and the state has communicated that should be receiving more of those. I wanted to give you some numbers. We currently have 11 COVID positive patients in the hospital. We have 6 of those patients in six additional patients in ICU. We have 23 patients that are awaiting test results. We at JPS have a total of 57 vents. 26 of those vents are in use. Not all those vents are COVID patients, but we are just giving you an idea that we have a total of 57 vents and 26 vents in use. Michael Hochberg and Dr. Fromm and Dr. Davenport and Dr. Teams have worked out ways that we can use our anesthesiology equipment to transpose and become ventilators. That will up our numbers should the surge hit. We have had 177 of our employees tested. We have a drive-through testing center for our employees at our Luda lab, or at our Luda clinic, and Joy Parker and her team and a variety of folks are doing incredible work there. Of the 177 employees tested, 16 have tested positive. Up to date, we have tested, including patients and employees, 485 tests. We have had 58 positive, 374 negative in that number. I will tell you that the group of people, as Chuck mentioned at the beginning, that are working on these issues have been phenomenal people. I have never seen people work harder. I, like Chuck, you can go through and you can look at people that are doing great. I try to make 30 to 40 phone calls a day thanking our employees. And I get those names because people in the organization say, this person did something incredible today. Sometimes just coming into work and being masked is an incredible feat. And I try to call every one of those people and let them know how much they're appreciated. I also want to tell you, as I have in emails and letters to you as board members, how much I appreciate you. You have allowed us to have the team that we have, and you've allowed me to surround myself with incredible people who have risen to the occasion in a crisis. There's not a single person that I wouldn't want to have on this team pulling this rope. I have a bad analogy, but all my analogies tend to be bad, and they tend to be numerous. And at that point, if you could hear the audio, all the staff is laughing. But I feel like we're a professional boxer, and we're in a ring, and we're a good boxer. The only problem is they put a blindfold on us, and we're not sure exactly which way to throw punches. But that coronavirus will walk in our way, and we will flatten it at some point. We are preparing as much as we possibly can for the surge. As I mentioned earlier, of all the things that we're doing, it is difficult because people will say, are you prepared for the surge? We're prepared for what we feel is a normal surge. We're even prepared for what we think might be expanded numbers. But if it becomes so great, we will have to call upon additional help. And I've talked to the county, and the county's talking to the state and the federal government about what we do for medical help from places like the National Guard or the United States Navy or other opportunities. J.R. Labby and the foundation are, and our foundation folks are attempting to raise money for various things, immediate needs. We are raising money for other areas to help people in any ways. We're trying to look at obviously what would be larger amounts of money and smaller amounts for daily needs. So our team is doing everything possible. So I personally want to thank you. I think that you all are board members for a reason. I think the staff is here for a reason, and we've been put in this place, I think, for a reason. And we are going to hold true to dealing with this on a daily basis for as long as it lasts. So I want to thank you all, and I appreciate you all giving me the time for the oration. Didn't mean it to be that, but it's critical to me, and it's painful, and it's also uplifting to work for an organization like JPS.
Robert,
Yes.
This is Reverend Emerson. What is the determinant or for a person to be tested when I'm looking at employees? Is it that they go and say, hey, I'm feeling bad, or it's just a random check? What's that?
No, we have it's a good question, Pastor. We have a screening process, and that screening involves a temperature, it involves flu-like symptoms, and there is an actual screening process that we go through. We do not because we can't, because we have a limited amount of tests. There will never be enough to test every person. And even when we went through the Ebola crisis and others, you have people that feel that they have the virus. In this case, this is a virus where early detection doesn't matter other than seclusion. So we always tell people, both our patients, the community, and our employees, immediately if you do feel sick, if you have flu-like symptoms, we ask you to begin to self-quarantine. If those situations get worse and you meet the requirements on a screen, we will test you. And then obviously, if you are positive, we will look at if you are in difficult challenges, then you will be hospitalized. But in many of the cases, Pastor, it is self-quarantine, staying away from family and others, quarantining yourself, and recovering as you go through this process. Thank you, Pastor. Any other questions that you all might have?
I've got one for you, Robert.
Yeah, Roger.
Thank you. Robert, thank you for your leadership in this time, and a special thanks to our amazing staff and the 7,200 employees at John Peter Smith Hospital. The information you provided us is fantastic, and I think I can speak for all the board members who'd say we would love to hear more, either through an email or a personal call. But thank you for that information. Months ago, we were straddled with the normal flu, the seasonal flu, and we were at several times at code yellow. How far away are we from that code yellow situation? Are we getting near that point? Is there another, I guess, a code yellow plan for this particular COVID case?
All good questions, and I'll try very hard to keep you all up to date as possible. And Amanda had sent me an email that I found very helpful. And what we put in place, the first thing is the phone call where people can call in and get our daily statistics. Diana Brodeur and the communications did that, not only for board members, but we did it for employees in the entire community. And if by chance some of you don't have that, I know we sent that information out. We'll be happy to resend it. That just gives you a daily count of how many are tested, how many are in the hospital, and everything that we have. Our surge plan really replaces our code yellow. And to speak earlier to my comments, Roger, we've seen volume decreases at urgent care, in our emergency room, and traumas. The sheriff called me this morning. He's had a population decline at the county jail. And it's not just because people aren't being arrested, but the shelter in place, a lot of people have taken that very, very seriously. And it's made an impact on all of our services. So our emergency room is got a smaller amount than what we had. The other thing that we have is JPS took the lead for our vulnerable populations. JPS took the lead in dealing with our homeless population. And what we did was we helped our homeless community and the shelters deal with social distancing. And Joy Parker and her community health team helped, along with the city and the county, open up the convention center so that we could have social distancing. That helped out a lot in the amount of people that were coming to our emergency room for other reasons. We have isolation rooms in the convention center. So code yellow basically now, Roger, is our code yellow plan. So it's the surge. But we're at this point, we are not at those levels because of the declines that we've seen in our regular volumes. So the other good thing that's happened down in our convention center is the ability to have isolation units and isolation rooms. That's been a big help for, again, that vulnerable population. The other thing is we're trying to work with the community on, and that's why I'm happy by what THR and Cook has done for us from a testing standpoint, but also trying to make sure that we meet all the needs of the community. and trying to figure out those that are challenged because they already had health issues. If you've got diabetes, if you've got immunity deficiencies, this disease is, going to be something we want to watch and look at very, very carefully. I do think that JPS up to this point has done a lot of, we were one of the first to start screening all of our employees and masking, and it is difficult. Also, Roger, I will do everything I can to keep you all up to date. My days consist of a variety of conference calls with state and local officials, trying to get ideas of what they're doing, but also dealing with staff meetings and trying to get constant up-to-dates. I will tell you that from Karen and Michael and Sharon and Wanda and the team, even with Laura Burnside and Leanne and everybody doing what they need to be doing, it is pretty phenomenal. And I'll try to get as much information without burdening you, but as much information as I possibly can.
Thanks, Robert. One last question, and I know we're sensitive to not to get in front of the county, but based on the models and the things you see, is there a window in which we expect to see this surge? Is it a week from now, 3 weeks from now? Do we have any kind of idea?
The first modeling that we were looking at, and it's the same modeling that the county is using and others at this point, is probably in a 2 to 4 week period of time. That number has been moving up because our numbers have not been as large. That's not to take any false sense of security. But if you're looking at a surge for Texas and you're looking at a surge, particularly in the North Texas area, it would be a 2 to 4 week period of time. And what we're doing is, the challenge with a surge is not so much, can you find the available space? Charlie Powell and other community leaders who have a variety of people in the business community, we have suggested hotels and vacant buildings. And we've looked at facilities working with the county that were former hospitals that still have the ability to have a room that could be connected with med gas and others. We have the building space. The biggest challenge for all of us is going to be the staffing, because you want to stand up everything and have it ready, but at the same time, you don't want to take staff in any way away from where you currently are. So it not to be trite, but it's a proverbial chicken and an egg. It is trying to get your timing down so that you can staff in need of a surge, but at the same time have your staffing needed for what we're dealing with on a daily basis.
Thank you, Robert.
Roger, thank you. Thanks for your support. Mr. Chair, that's the comments that I have. And if you all have any additional questions, do the same thing. Text me or call me after the meeting. Anything that you all have, feel free to do that.
Robert, I just have one question. This is Amanda.
Yes, ma'am.
Hey. Well, I just want to say thank you specifically to the communications team, everybody at JPS. It's been really, really phenomenal to see people kind of step up in this way. One of the things that we're hearing from the community, and I want to get some assurance on it, is that, and especially in bilingual communications, not only in Spanish, but Vietnamese, Arabic, all of that within our social media aspects as well. But we are hearing some reports, but not necessarily from JPS, just from hospitals around. We want to make sure that there's an assurance for our undocumented community that they feel comfortable enough coming in. And we just want to make sure that that's firmly communicated out into the community as well.
No, I appreciate that very much. The first press conference I attended, Diana Brodeur and I attended a press conference with the mayor of Fort Worth, the mayor of Arlington, and the county judge. And that question came up. And Mayor Price quickly said, I have the confidence of hospitals and I have the confidence of this community that every individual, no matter who they are, no matter what the situation is, will be treated in not only respect, but dealing with that issue. So we'll do our best. I will say that there's two things, Amanda, and you and I have, at least by email, looked at a few of them. You know, in addition to the coronavirus, we have daily operations, and there are great strains on some of our networks changing our pharmacy over to call-in pharmacies. We've had challenges in those phone lines and those wait times, and we've told Nicole Showquist, and Karen Duncan has done a great job working with that team of getting those wait times down as we transition quickly in a 3-week period of time to a different form of operations and a different form of call-ins. So to your point about taking care of the community, JPS is prepared and ready. I think my colleagues are as well. We need to do the best job we can now of getting that information out to many different languages. And we will obviously try very hard to do that. And I think we're gonna do everything that we possibly can. We're also going to mail order refills and trying to do the best that we can. Again, that's a quick transition. We had mail order refills, but not to the extent and numbers that we're starting to have them. And I know you had some challenges, and we did a secret shopper program for the last 2 days, and we've witnessed those challenges, and we'll continue to work on them. So I appreciate, Amanda, your input during board meetings and outside of board meetings. I appreciate them very much.
Yeah, I think the teams are doing an amazing job of shifting through. We just want to make sure that what we've got. So thank y'all very much.
You bet. Thank you.
Anybody else? Any comments for Robert? Okay, the next item is item 7, report from the Medical Executive Staff Committee requiring discussion, deliberation, actions, or approval. Is Cheryl there?
Yes, sir. I'm here.
All right.
Thank you, Mr. Chair, and thank you, board members, for having me. I'll be actually brief for this section. Sorry, I'm glancing over at my other computer so I can make sure I get it correctly. And we respectfully request your approval for consideration of the a change in leadership in the emergency department. The Med Exec Committee did meet and approve this to move forward for recommending to the board. And the department has chosen Chet Schrader for the chair of emergency medicine and Ryan Kirby for the vice chair. I would appreciate a motion.
Trent Petty, so moved.
Amanda, second.
Thank you.
Any discussion? I'm going to do the same thing. If there's a negative vote, just say so. Other than that, we'll assume that everybody voted positive.
That's
okay,
fine.
Cheryl.
Yeah.
Great, thank you. Appreciate it, board members. Thank you. The next item is a consideration of approval of the appointment of Dr. Oliver Kesterson as vice chair for neurosurgery. This again was also approved by the MEC on Tuesday, or excuse me, last month actually. I would appreciate a motion.
Chuck, this is Charlie. I move for approval.
Steve Simmons, second.
Any discussion? Anybody opposed? All right, Cheryl.
And my final item under this, thank you again, board members. I appreciate your time. It begins on page 30, is for considering approval of endovascular privileges for several of our disciplines. If you can go to page 30, it shows that the legal counsel has reviewed these and given their approval for the privileges as they are written. And it begins by citing who will be available, and that's vascular surgeons, interventional cardiologists, and interventional radiologists. So again, that's pages 30 through 30, excuse me, make sure I get them out, 30 through 34. And the Med Exec Committee did approve these for recommending to move to the Board of Managers for approval of these privileges. I would respectfully request a motion.
Steve Simmons, so moved.
Zimmerman, second.
Any further discussion? Any negative votes?
Who made the motion? Who made the motion?
I made the motion.
Steve Simmons.
Steve Simmons did.
Okay.
Cheryl, thank you very much.
Thank you, Mr. Chair.
Mr. Chairman, I will tell you that the leadership of Cheryl Hurd and Janet Miles, I was on the phone yesterday trying to get the equipment for testing with Janet Miles 5 times. And then Janet Miles ended our evenings with an hour-long phone call with the county judge at 9 o'clock. I've never witnessed the acts of a group of physicians like the ones we have to Chet Schrader and his team in the emergency department to Dr. Davis and all that we have, and Dr. Batamosi and what we're doing in the ICU, what our floors that have been dedicated to some of our coronavirus patients. Not only that, but the likes of Nancy Ratke from nursing. I don't have the names in front of me because they're sort of emblazoned in my heart. But to Cheryl Hurd, being the chair of our MEC, she is fantastic, and being able to work with her and have our mobile numbers call all. We never have a problem talking to each other because of the phenomenal nature of her leadership, and that sets the tone. But I just need you all to know, and Chuck, you know this even from your days, and Dorothy as well, but we have a phenomenal team of doctors. And when I went to the press conference and they were talking about social distancing and shelter in place, and there was a lot of debate about it, they asked me to comment. And I said, it's real easy for me. I listened to the doctors and the nurses at JPS, and I'm going to stay sheltered as I can possibly be because I believe in my doctors and our nurses. So Cheryl, to you and the team of doctors, you all are incredibly phenomenal people.
Thank you.
All righty. Roman numeral 8. Other matters requiring board discussion. First one is discussion of legal services provided at Tarrant County Hospital District with Trent and Ms. Montoya.
Mr. Chairman?
Yes, sir.
This is Roger. Would it be possible to move item 8A to executive session? It's sort of a personnel matter. And I'm not sure exactly what all is going to be discussed, but I'd like to hear it in closed session before a plan is presented that we haven't seen.
Neil, how does that work?
Get me off mute here. That's a permissible item to go to executive session. That's up to the board.
Okay, do we have to vote on that, or is it just okay if we can move
No,
it?
if nobody objects, then you move it to executive session.
Okay, anybody object to moving it? All right, we'll move it to, Roger, we'll move it to executive session. You bet. Then that would bring us to Sharon, acceptance of February 2020 unaudited financial report.
So thank you. I do know that we have an extremely long agenda today. So what I was planning to do is just give you a quick summary of the February financial statements, unless anybody has any specific questions. I'd like to start on page 50 of your book, and this is actually our combined income statements. I will say that February was a very good month financially. I wish we could spend a little bit more time on it, but we did have very strong volumes and a nice favorable payer mix. So the medical center actually came in about $5.5 million ahead of the budget for February at $9.6 million. A claim was about $850,000 behind their budget. So if you are looking kind of about 2/3 down the page, you'll see that our income from operations for the month was $7,013,000 compared to a budget of $2.5 million. That brings our year-to-date combined total on the far right-hand side of the page to $22.4 million compared to a budgeted margin of $16.4 million, or about $6 million ahead. So again, it was a very strong month in February, and we're going to cover a few questions that you may have about March and closed. We're going to try to give you a little financial impact analysis of what the last couple of weeks of March may mean for us when you look at the full month. Are there any questions that I can answer about the February financial statements?
Sharon, that was starting page 50 of the electronic book.
Yes, sir.
Thank you.
Page 50, 428. It is the next to last slide on the financial report.
Anybody got any comments, questions for Sharon? Sharon, you're going to keep right on going with these, correct?
I'm going to be talking for a little while, yes.
Okay, well, we have to vote on the unaudited financial report.
Yes, sir.
So
I move, this is Steve, I move approval.
This is Charlie. I'll second.
Any discussion, thoughts by anybody? Then we'll take the negative vote once again. Not hearing any, motion passes. Okay, Sharon, item C.
Item 8C is a line of liquidity. And I want to give you a little bit of history on my thinking behind signing this line of liquidity. About 3 weeks ago, in preparation for things that we don't know yet, I wanted to secure a line of credit, in essence, for use on an emergent basis. This is not something that I think we are required to obtain at the moment, but now is the time to get that. So if we are in a current crisis for another 2 to 3 months, we may need to access this line of credit. As we walked through this, I pulled a team together that consisted of our advisors from Hilltop, Chris Janning, as well as a legal team with Bob Dransfield from Norton, Rose, and Fulbright, and Jonathan Krantz at Kelly Hart and Holman, who do advise us on any debt issuances. There were several opportunities of credit lines that we could have accessed, but we all agreed that a revenue bond certified obligation was the best fit for what we needed here. It does require Attorney General approval, which we did to move forward, and it will require Commissioner's Court approval, which we may obtain next Tuesday at their regularly scheduled meeting if it gets approved here by the Board of Managers. So there's a calculation that they use for our cash flow. It's not a typical accounting cash flow definition, but we would qualify for up to $75 million worth of credit in this facility. This credit line would be good for 364 days, just under a year from the date that it is enacted. Generally, the rates, there's an upfront charge that works out to be about $75,000. And if it goes unused, there's a 50 basis point fee, which works out to be $375,000. If we borrow against this liquidity line, it's a % of LIBOR. And right now that cost would be about 2.3 percentage points. So I'm proposing your approval, or I'm requesting your approval to go ahead and execute this line of liquidity for JPS at some future date. Again, this is not something that I see that is imminent, but I do think that we need to go ahead and secure the line of credit.
Sharon, I have a question. This is Amanda.
Yes, ma'am.
For this particular line of credit, what are you seeing it total use for? Is it for maintaining payroll, maintaining overall operations, or is there any other specific items?
So the line of credit as it's defined and what we can borrow for is for capital purposes. So if somewhere down the road we would need additional cash flow, I could finance any capital needs that I would have over about a 3-year period if we could project those out. So if you're looking at the actual term sheet here, it does list capital purposes, but it would just really be a shifting if you needed any cash flow.
Thank you.
Sharon, do we, have we ever used this, this revenue bond CO before? And B, if we go forward with this and it's approved by the Commissioner's Court and we have it, do we intend on using it? Do you envision using it? Because my Aggie math says we're going to spend $450,000 no matter what.
That's true. So we came from the same place. Your calculations are correct. But correct, you know, it's not something that I'm planning on using, but by the time we get to, again, if this crisis lasts for another 3 to 4 months, and we do require some cash flow, at that point in time, it may not be obtainable. So it is, the credit facilities are getting used up very quickly now. Almost all major corporations have gone to their bank and tried to secure some sort of liquidity instrument like I'm presenting to you today.
Karen, this is Zim. Along the lines of Roger's discussion, you're going to give us in closed session some the financial impacts that you're seeing so far, right?
I am.
I would like to defer this until after that discussion so that we've got a better basis for making a decision, because $500,000 I would bend over to pick up.
Okay.
Okay.
Mr. Chairman, would you like to move on that proposal?
If it requires a motion, I make that move.
Actually, it doesn't. It can be moved to executive session, Mr. Chairman, if no one else objects.
Right. Anybody object to moving it? Hearing none. Okay, then item C, Sharon, will go to executive session.
Okay. I'm going to move on through the agenda. And again, all of these do require separate motions by the board. So just keep in mind that there are quite a few contracts and approvals that will be rolling through here. So next on the agenda is 8D. This is a contract for up-to-date software. It is available to all of our clinicians. They can pull it up on a computer or on the cell phone. It's actually a clinical decision support tool that we have used for several years here. And this is the renewal. This software is integrated to Epic, our EMR, as well as a drug database that ties back into the pharmacy. It's an escalating cost over 3 years for a total of $837,000 over the 3-year term. So I'm requesting approval for the up-to-date software. This is also kind of a dual approval for the sole source as well.
Correct. Yeah. You're approving the exception to the bid statute as well as the contract itself.
I'll move approval.
Do you want to approve both of them, Zim?
Roger, yes.
Yeah, they need to be. They can be one motion approving the exception, the exemption, as well as the approval of contract.
I'll second that. This is Zim.
Okay, we have that. Any further discussion? Those opposed, please say aye. Motion carries. Sharon, you're up.
All right, thank you. I'm on letter 8E, which is on page 75 in your board books. This is a contract with Duval. They provide standardizing surgical mesh in the OR. This was a result of a surgeon task force. It was an RFP and it has GPO pricing. This will produce about $1,500 to $3,000 savings per patient. So over a 3-year term, the total spend is projected to be about $1.46 million, which is a savings of almost $300,000 over the 3-year term. And it does have a 2-year optional extension.
Any discussion for Sharon? Entertain a motion.
Move approval.
Move for approval.
And this
This is Steve, I second.
Any discussion? Do we hear a negative vote? Motion carries. You're up, Sharon.
Okay, we are on 8F, which is page 102. This is for Central Admixture Pharmacy. This actually allows compounding of drugs. It is an RFP result. And again, this allows, it increases our supply source of TPN for adults in ICU as well as at-home patients. It has a 3-year term at a cost of $2.1 million. It does have an additional 2-year optional extension at the end of that 3-year contract.
Just for the rest of the board, when Sharon says TPN, total parenteral nutrition is what is done by intravenous feeding for those that cannot eat or use their intestines. So if somebody'd like to make a motion to approve, we'd entertain it.
This is Sam. I move to approve.
Second.
And I think this is a sole source thing as well, isn't it, Sharon?
No, central admixture is not. This is
Okay.
item F.
Okay. Any negative votes? Seeing none, go to item G.
Okay, so on item G, this is page 117 of our packets. This one is an exception to bid. We also are requesting this capital item at a cost of $190,000. This will replace system controls in the main tunnel washer or where we take care of our linens. It extends the life of the current equipment by another 8 to 9 years. This is a proprietary system upgrade that we are requesting.
Steve, I move approval.
Steve Simmons, second.
This is sole source though, Sharon.
Yes, it is.
We need a
Proprietary software.
your motion had 2 parts.
I move that the sole source rule be exempted for this particular item and that the motion be approved.
Second to that.
Second.
Any discussion? Negative votes? Not hearing any. Motion passes. H, Sharon.
Okay, item H begins on 148 of your packets. This is a Microsoft server and cloud enrollment renewal with SHI Government Solutions, Inc. It is a 3-year term for a cost of $1.6 million. And this also allows standardization of key server and cloud technologies.
DT approve.
10 seconds.
Any discussion? Any negative votes? Motion passes.
Letter I begins on 178 of your packets. This one is also with Microsoft and SHI Government Solutions. This one is for our overall enterprise agreement for Microsoft Office, Windows, and it also includes additional cloud-based subscriptions license for Microsoft Office 365. This is also a 3-year contract at a total cost of $4.7 million.
Any discussion for Sharon? Entertain a motion.
This is Zim, move approval.
DT, did you second?
I'll second.
Any further discussion? Any negative votes? Motion passes. This was a sole source one though, wasn't it, Sharon?
Yes, item J on page 206 will be a sole source or a exception to bid. It is with AT&T Universal Extension. And this is for the voice connectivity between our main campus and many of our clinics over a wide area network. These are proprietary circuits, and this is an extension for a 3-year term for a cost of $341,000. So this would be a double motion.
This is the non-Dr. Steve moving approval of the exemption and the motion.
This is the Dr. Steve, second.
Okay, any further discussion? Any negative vote? Motion passes. Before we go on, items, let me tell you how we normally do the agenda. The executive committee would meet with Robert and we would go over each item. And this time, I was the only one that looked at the agenda other than Robert, and there were a few things that I missed. And K and L on the agenda shouldn't even be here. So don't worry about them because they've already been dealt with. And then we're up to item M.
Okay, item M has also been postponed to the next board meeting. Good. So I will be presenting next item 8N, which is on page 222 of your packet.
Okay.
This one is an exception to bid as well. And I'm looking for the contract approval with Southwest Elevators to modernize elevators 12, 13, 14, and 15, affectionately referred to as the red elevators. This is a $1.5 million capital request.
I have a quick question. Sharon, when we say modernize, people think that it's going to look pretty, but this is along the lines of the previous modernizations with brakes, cables, all equipment, correct?
Correct. They may not replace the car itself, but it's all of the interior components that are impacting the motion. So it's actually rebuilding the infrastructure of the elevators.
Safety features included?
Yes.
Or is it just simply cosmetic, or is it a mechanical overhaul as well, I guess?
It's my understanding, Roger, that it's a mechanical overhaul and the pads inside the buttons are more computerized button panel. The modernization is pretty much everything except what Sharon talked about. You may not actually have to modernize the entire car or the box, but everything else is an update in equipment, and it becomes a digital screen and modernization of the equipment from everything from the ropes and everything involved in it. So you're right. It's not just a cosmetic cleaning. It is a total mechanical renew.
Are there other elevators, Robert, that are in need of more dire service than these? These are used a ton, there's no doubt. But
they are. When the purple elevators were taken down for some of the challenges we had there, we have put all of our reliance on some of the other elevators. So we prioritized, and that's what this is. The first modernization that we did were the elevators that were out in the parking garage, and they had over time become to the fact that they were shutting down and challenges almost every day. So that was our first priority, and now they're the red elevators along with the purple elevators.
Okay, thank you. I'll move approval if there's no other.
This is Reverend Emerson. This particular cost is this included in what the original bid, or is this over and above that?
So Reverend Emerson, this was included in the fiscal year 20 capital budget.
Any other questions? Reverend?
Jim will second.
All right, any further discussion?
This is a double approval again, with exception to bid as well as the contract itself.
My motion stands.
Jim, you seconded,
Jim seconds.
or both to approve and the sole source?
Mr. Zimmerman, I think the question to you is, it's a sole source, so your second needs to confer that you would be seconding the sole source and your original motion.
It's actually not a sole source, Robert. It's actually related to health and safety of residents, and the fact that we're using the same contractor enhances that. So, but it is an exception to bid.
Okay, sorry.
Okay, it's called exemption to bidding.
Yeah.
Subject to bidding and approval.
All righty. Any negative votes? Motion passes. The next item is 9, and these are ratification of emergency matters that Dorothy, Roger, and I approved before we could get to the Board of Managers. And the first one is the ratification of approval of the privileges consistent with the Joint Commission regulations of the medical providers listed on Board Advantage. And Neil, what do we have to have? A board vote?
Yeah, we need a board vote on these. These would have, what you're voting on is ratifying the officer's approval of these so that these privileges would have expired, and a number of providers would have not had privileges at the hospital and could not wait since we did not have a March board meeting. So the officers, under previous protocol of the Board of Managers, have approved each one of these items. In this particular case, is the joint is the privileges.
Trent Petty, motion to approve.
Those that.
Yeah, Trent, go ahead, Trent. I'm sorry.
That's motion to approve.
Yeah, and I would second that. Having been there, and if executive committee approve it, I'd second.
Any further discussion? Any negative votes? Motion passes. Number 2 is ratification of approval of the master license and service agreement and order form between the WellSky Corporation and Tarrant County Hospital District.
Chuck, would you like me to give a little update on that one?
Yes, ma'am. Thank you.
Okay, we're on page 288 of your handouts. This is with WellSky Corporation. This is for the replacement of our blood bank module. This was presented to Finance Committee on February 27th. This was competitively bid. It does provide Epic integration with our lab system. So the total cost of the contract is $597,000 over the 3-year term. $298,000 is in our capital expenditures, and then there's $300,000 of operational cost over the 3-year contract.
If there's no discussion, I entertain a motion for approval.
Zim moves to approve.
Simmons second.
Any further discussion? Not hearing any negative, motion passes. You want me to do number 3, Sharon?
No, I can just kind of continue on through.
Okay.
All right, we are on 9A3, which is ratification of approval of PC 4000 risk assessment, identification and management of obstetric hemorrhage. This was on the quality agenda, which was canceled. And if it was not approved by March 31st, it would have created some unfavorable results in our DSRIP reporting. This is as we're working through maternal level of care through a state requirement and DSRIP. It's really just documentation of what changes that we've made and were in progress at the time.
Entertain a motion.
This is non-Dr. Steve. I move approval.
Dr. Steve will second.
Any further discussion? Hearing none, no negative votes, motion carries. And that takes us to B1, Ms. Sharon.
Correct. So the next 3 items were also approved by the officers on March 26th, and we are looking for ratification of these contracts. Item 9B1 on page 341 of your books will require an exception to bid vote as well as a contract vote. This is with the Brandt companies. It is a replacement of the chiller that was vandalized at our Stop 6 clinic. It is a capital expenditure for $105,000.
Just one question on that at the Stop 6 clinic. Is that unit on the building or is it out on the side of the building? I can't remember.
I believe that it's on the side of the building. I'm not confident about that, but I believe that the chiller was on the side of the building and it was vandalized during the evening.
I believe it's on the side of the building, as part of the bid was replacing some of the fencing and security measures around it.
Yes, we have secured the replacement chiller.
Well, this is an individual not named Steve nor a doctor, but I've moved for approval.
And this is a dual motion.
Yeah, another.
Yeah. I'll cover both in the motion.
Okay.
Thank you.
Second.
This is Jim. I'll second whatever doctors and non-doctors including.
All right. Further discussion. Hearing none. Negative vote. None. Motion passes. Okay, Sharon, B2.
So 9B2 is again an exception to bid contract with Covidin for 18 ventilators. We moved these ventilators in response to the capital plan from 21. We moved them up a year. This will allow us to keep the older 18 units as well as bring on 18 new units in preparation for a surge. This was a capital expenditure again for the 18 units for $694,000.
One question, have they been delivered?
I believe that they are going to be here next week.
Well, I would certainly move for approval. Mr. Charlie.
Jim will second. And Mr. Chairman, I believe DT had some questions about this item. I don't know if he wants to address them now.
Yeah, go ahead, DT. I got your email. I think part of DT's, there you go. DT, you want to comment?
I got cut out a little bit, so I wasn't. Can you repeat the question for me, please?
You had sent us an email about one of your concerns about when ordering the ventilators, and I think it had to do with price.
Yes, the question I have is kind of along the line of tracking to see the price adjustment that we can understand so that later on if we need to reevaluate, the impact of the event, to see how do we justify a higher pricing if it's because shipping, like they have to use a by plane versus by ship or some cargo, and stuff like that, so that we can determine to see what kind of price difference are we paying. Is it so that for somebody who just have a price chart without any explanation, then we need to revisit that and see if we, for consideration for down the road, if we want to use the same vendor down the road, if they're taking advantage of us or not. But more likely just to explain to the taxpayer what kind of pricing difference they are. That's one. Number two is that I think we need to look at also. It's 2:30. When we deal with the ventilator, the result coming from New York is not that great for people that are using ventilator, because 80%, the normal death is about 40 to 50%. For COVID-19, it's up to 80% death result. And so we need to take a look at that to see if, is there a better way, because you deal with exchange versus, most people die. I think he's trying to solve the oxygenation, but most of the death is a result of blood clot and other stuff. And so I think we may want to learn from what they're doing and look at to see how much we want. I mean, from a medical perspective, how much do we really want and how many ventilation do we want to have, and all that stuff. So we can discuss that later on offline, but from a cost perspective, I like to understand more specific to see a normal one, probably 25,000. So the newer ventilation, maybe 37, 40,000. I need to be able to explain that later on.
Okay, DT, I just want to tell you this was actually part of the GPO pricing. So, and the ventilators that we replaced were past their useful lives. So this would be a normal capital replacement that we just moved up 6 or 8 months so that we could make sure that we were prepared.
DT, this is Charlie. I truly respect your comments, and I think your comments are right on. I guess since I made the motion, I know it's been seconded, I guess I'm having a hard time knowing the current environment. And I think you bring up some excellent points about how those ventilators should be used, and what's their effect. I'm going to check to the doctors in the hospital to make that one. That's certainly not within my realm of experience. I'm having a hard time as a board member knowing in this environment that we have the ability to get 18 ventilators. And I just heard staff say that we've got some past their useful life. So again, Mr. Chairman, I truly respect those comments. It's your call, but I'll leave the motion as it stands.
Oh, no, don't get me wrong. I think we need to get the ventilator. I have no problem at all. My question is that should we start tracking if the price difference in what we normally would get and what is current price today, so that when because at the end of the year, we're going to have to revisit to see why are we paying so much more, and there's an explanation that we can explain why there's a difference.
Yeah, DT, I totally agree with you. I think you're right on. There's no question. You and I are in 100% agreement.
Yeah, I think that's fair. Okay, there's been a motion by Charlie Powell. Is there a second?
Jim seconded.
Any further discussion? I don't hear any negative votes, so motion passes. Sharon, I think you're...
Yes, sir. We are on 9C1, which is on page 384 of your packet. This is also for ratification. This is an exception to bid as well. It is with Stryker emergency relief beds. We were able to obtain 100 emergency relief beds, which are, they're somewhere in between a cot and an inpatient bed that we would normally use. They are a lower cost option. Beds are not available right now, but if you recall, right at the end of last fiscal year, we did a huge replacement of our inpatient beds. So this will supplement the current beds that we have and allow us to expand our inpatient capacity during a surge. The other advantage with these beds is they store flat and they have multiple uses after the COVID-19 crisis is over. So again, 100 beds. This is going to hit our minor medical expense for $185,000.
Any discussion for Sharon? Entertain a motion to approve.
Steve Simmons, so moved.
Is there a second?
ET second.
Do we need a double motion here as well, Sharon?
Yeah, you're covering the exception for public health safety.
The exception also.
All righty. With that motion, Suzanne, did you get the names?
No, I got cut off and I just got back on. So on C1, is it Steve, Dr. Simmons, and DT?
Yes, Suzanne. Steve
Okay.
Simmons, so moved.
You got it, Suzanne?
Yes, got it. Thank you.
Any further discussion? Do I hear any negative votes? Motion passes. Next is item 10, which is the consent agenda. And Amanda sent me an email that she would like to consider remove item 10B. Has everybody got that one?
You got cut off. Can you tell me again which item we're removing?
It would be item 10B.
B, okay.
Which is the approval of, LDF 5000 JPS connection program policy. And Steve, can we move this back to your committee? The non-doctor Steve?
Sure, I'm happy to bring it to reconsider it or have more discussion in finance, whatever the board desires.
Let me clarify. I just needed it off of the agenda item to have a no vote on it. I don't think we have to go back to committee with it.
I'll say again, I couldn't understand you, Amanda.
I was voting no against that one. And so I don't think it has to go back to committee, but we needed just to take it off of the consent agenda for me to be able to vote off of it.
I'm not sure what you're asking me to do here.
This is Steve. I think, and I agree, just asking to remove that item from consent agenda so that she can cast her negative vote. Correct?
Yeah.
Okay,
She doesn't need it to go back to finance, is what you're saying.
Okay. Well, there's a number of these that will be on the consent agenda. So why don't we deal with item B right now and just go ahead and call for a vote on that one. If somebody like
Mr. Chairman, Amanda, if you don't mind, could I get a little insight as to your opposition?
Yes. As discussed in the finance committee meeting, my opposition with this particular one isn't with the connections program itself. It's with the language excluding undocumented within that program. And so I am a no vote on moving forward with the program with that language and as an eligibility requirement.
Thank you very much.
Thank you.
Anybody else got questions for Amanda? Then I'd go ahead and entertain a motion to approve. And I didn't hear any.
I'll move approval.
Okay, Roger Fisher, move approval. Is there a second?
Steve Simmons will second.
Okay, any further discussion? All in favor, please say aye. Negative would be Amanda.
Yes.
On there also as well. Okay, well, it's DT.
And what did you say, DT?
Mine's a no also as well.
Okay, so 2 negative votes.
No, it's 3.
Three.
I want mine to go as a no too. Okay.
And that's from Dorothy. You got all those, Suzanne?
Yes, on number 10, line item B as in boy, DT, Amanda, and Dorothy, removed from the vote?
No, they voted.
No.
It was removed from the consent agenda, and they voted no, and the remainder of the board members voted yes.
For the whole consent agenda items?
No, just B.
No, just for B.
Just B. Okay, got it.
All righty, so that motion passes. Now, then items A through
M.
A through M is on the consent agenda.
Except for B.
Correct, except for B. I'd entertain a motion for approval.
This is Dorothy DeBose. Move approval for items all except B.
Okay.
Zim seconds.
All righty. Any further discussion? Any negative votes? Motion passes.
Hey, Chuck, this is Trent.
Yes, sir.
Just for discussion's sake, at some point in time, I didn't hear Amanda object to this going back to Finance Committee. Is this still something that we could decide to take back to Finance Committee so we can get more information and discussion and, you know, some thoughts on it?
I would be for it.
Administration would be fine with that, Mr. Chair. We don't have a problem. We'd be delighted to have further discussion in the finance if that's the appropriate place that the board sees fit.
I agree with that. Steve non-doctor agrees.
Okay.
Parenthetically, Steve can put it on his agenda.
Yeah.
No,
Trent, for clarification, I agree with you. I think additional information would be good. So whatever we need to do and how we legally need to get it back to finance, is it reconsidering this one or is it reconsidering as a whole? But I agree with you, Trent. I think that's where it ought to go and for further discussion.
Any board member can request that an item be placed on any of the committee agendas. So, I mean, you've already taken a vote today, but if anybody wants to put it back on a finance, then it'd be a request to put it back on the finance committee agenda.
Thank you.
Any one of you can do that.
Consider it requested.
Any board member, even Roger?
Some
don't consider me a real board member, so.
Okay.
So the question, my question, Mr. Chairman, for Neil is, since we had a affirmative vote on that item, do we need to, and it's technically now a policy in place, do we need to void the last vote and then vote to move it and then move it? Because technically it's
actually an adopted policy as of this vote. Okay. If you want to reconsider that vote, then it would take a majority of those that voted for the motion to reopen it. If not, then you can turn right around and any one of the 11 of you can ask for that to be put on the next finance committee agenda for further discussion. The policy is going to be in place, which has been in place for a number of years until there's further action from the board, whether that be through the committee process or ultimately the board at a subsequent action.
And just since I brought it up, I'm not asking that we go back and re-vote at all. I accept the vote and I understand the vote. I just think that it's a policy matter that warrants additional board discussion. I think we need to give it that opportunity.
Yeah, I'm fine with that.
Great, Trent.
I agree with that wholeheartedly.
Okay.
Yes, thank
That's
you.
what, that's what we will do, Amanda.
Thank you.
Okay.
Thanks, Amanda.
That takes us to report of legal counsel and or legal matters requiring discussion update.
I have one matter, just my normal and open would be for the month of February, there were 21 contracts negotiated under 500,000. I do have a couple of items to discuss in executive session.
Okay, well, we don't need to vote on those. So we're now down to item 12, which is reconvene in the executive session.
Chairman,
I'm sorry.
could I bring up something before we go into executive session?
Sure.
I want to go back. I didn't say much before. I want to go back to Amanda's question to Robert early on in his report about undocumented and the treatment of those undocumented. And I wanted to ask Robert and staff, is it possible that based on what we're reading in the news recently about data showing those infected or have died from a race position, especially Afro-Americans and Latinos, is there any documentation that JPS is developing or keeping that shows what that ratio is versus non-minorities? Is that possible we could do something of that sort?
Sure. Pastor Emerson, I spoke with Commissioner Roy Brooks about that yesterday, as a matter of fact, and we'll collect not only all the data, but we'll look at trending and we'll look at the situations that are confronting any of our populations, including those that may be more susceptible to these issues. But yeah, we will collect all that data and be able to share it with other hospitals to see what those trends are.
All right, thank you.
Mr. Chair, if I could, if you would afford me the luxury, I do want to thank, while we're still in open, I want to thank Sharon, because Sharon took on yeoman's work in this. We didn't want all the members of the executive team bouncing back and forth with the contracts. So Sharon happened to be in the meeting and Sharon made eye contact with me. So she got the job of sending all the contracts up. And I want to thank her for that on behalf of all the executive team. We thought that would help the meeting go much more smoothly, but Sharon took on a huge amount of work to take on everybody's contract. And I just want the public and others listening in on this to understand the work that CFOs do beyond CFO work. So thank you.
Well, you realize that nobody will ever look you in the eye in a meeting from now on.
They don't. Usually they don't anyway. Sharon just made a mistake. So,
Mr. Chairman, I have a quick question before we go to close.
Yes, sir.
Is the information that's on the board portal, I have a 444-page agenda document. Is that the latest and greatest updated portal document? Because it seems like to me, when Sharon would call out page 283, I would be 1 or 2 pages off. And then it seems like we were 2 pages, 3 pages, sometimes got to 4. And then when we got to the last item, I was -1. And so I want to make sure that there's not pages missing or inserted or whatever that we haven't seen. It seemed like the numbers were off, and it seemed like that we would all have the same portal. Or I'm crazy, either one.
Could be both.
Yeah, maybe.
No, we can do that. That's always been a bugaboo of what comes out in the board book by pages and what we get on the board portal by pages. I'll leave that up to Robert and company to get that squared away. Is that fair, Robert?
You bet. It's more than fair. And Roger, to your point, we may have a numbering issue, but from what is on the portal to the board book, I haven't seen, and again, I haven't gone through every single page, but I haven't seen anything that's not there. Again, right now, I'm going to tell you, I think it may be a numbering issue, but I don't think anything is missing from either one. But we have had challenges sometimes transposing from the electronic version to the actual hardbound edition. Okay. So, but I don't think anything is missing. Sharon, I don't I don't think you saw anything missing in the process or Suzanne saw anything, but we'll certainly go back and check and we'll look to make sure that's not the case.
It was, we had a printing issue when we were copying the hard copies. So there was it was not, anything's not missing. It was just a number paging that was the mistake there, but there's no documents missing, just the page numbering.
Okay, thank you.
Roger, I want to thank you very much for being the Aggie that spoke up that said we didn't get our numbering right. I appreciate that.
Well, we'll get it squared away on how it's going to be presented.
You bet.
We're now going to reconvene in executive session pursuant to Chapter 551 Texas Government Code for the following, in addition to matters posted for deliberation. And how about if we take a 2 or 3 minute break? Is that all right with everybody?
Mr. Chairman, this is David. We are going to be cutting down the live stream. I will let you know when that is down, and then you can pursue from that. Okay?
Okay.
In a few minutes. Thank you.